Hi, this is Jim Dadovich from LKC Technologies coming to you live from the American Academy of Ophthalmology meeting in New Orleans, Louisiana. And I'm delighted to have with us today Dr. Igor Kozak, who's a vitreoretinal surgeon from Moorfields Eye Hospital in Abu Dhabi in the United Arab Emirates. Many of you may remember electrophysiology or ERGs from your medical school training. And you remember these large machines that sit in these rooms, and you need dark adaptation and the electrodes touching the eye, and very, very complex, difficult to use, difficult to interpret. And we're here to talk about a new revolutionary device called the Retival device, which is a handheld electrophysiology system. And Dr. Kozak has used that in his practice in the United Arab Emirates. And so I'm delighted that he's agreed to join us today. And I'd like to start the discussion by just asking him a few questions. Tell us a little bit about the clinical work that you do in UAE, and how you might use the device and the types of patients you see and study interest that you have.
Thank you, Jim. It's a pleasure to be here. So I'm currently practicing in the Middle East, in United Arab Emirates, and we are seeing all kinds of patients, a majority of which are diabetic patients. So we are dealing with complications of diabetes, such as diabetic retinopathy, and a substantial portion of our patients are dystrophy patients, patients with inherited retinal diseases. And for these kind of patients, you need, of course, an excellent diagnostics.
Okay. Yeah, and one of the amazing things is the Middle East has the highest incidence of diabetes in the world, and so it's not surprising you would see a large number of diabetic patients. So, what are some of the challenges that you face in managing your patients with diabetes?
Right. So diabetes can affect eyes in a very deleterious way, and some of the challenges in our population is actually non-compliance of patients and non-adherence to treatment regimens. At the same time, if you have a patient with many morbidities, they pay attention first to fix their problems with their kidneys, with their heart problems, and sometimes, they push away eye problems, for a later date.
Okay, and in your practice, what are the indications that would indicate that you would use the Retival in evaluating a patient?
So that's a very good question. Electrophysiology has become a standard armamentarium in our diagnostic process, and uh, we don't have to explain about the role of electrophysiology in ERG, specifically in inherited retinal diseases. We are very happy to use this user-friendly, handheld device. We've been collecting lots of data on these patients. It helps us diagnose patients, and even if it is a rare case of a dystrophy, we just collect data for a follow-up. So that's an indispensable diagnostic equipment. We also have used Retival in evaluation of diabetic retinopathy, serious cases of diabetic retinopathy. As a matter of fact, we also used it for screening purposes. That was
Okay.
5 years ago.
Okay. And how does it integrate within the patient flow of your practice?
The advantage of having something, handy, as you described it, is that you don't have to allocate a specific room with conditions like illumination or isolation. You can use it in the clinic. It's user friendly. As I mentioned, we have technicians and nurses who perform this before patient reaches the physician. I can then read the data, and it's very quick to use.
Okay. Now, historically, you've had to dilate the eyes, you had to anesthetize the eye, and you had to put an electrode right on the cornea of the eye. How is the use of Retival different in that respect?
Well, we are very thankful that we don't have to do this. Patients appreciate it enormously. Um, with dilation, you're actually talking about an invasive diagnostic procedure, so to speak. We don't have to do any of that. Placement of skin electrode is very easy, even including in pediatric clinic. So the whole process is just faster and more pleasant, both for patients and as well as for healthcare staff.
Okay, and how have your techs adopted the Redival device? How do they feel about using it in your practice?
They have absolutely no problems. The learning curve was very short. Um, they incorporated it into protocol of, again, specific diagnosis that we use it routinely, and it poses no problem whatsoever for any of them.
Okay, and it's the other issue that some people have is interpretation of the results, and there is a large normative database within the product itself, and when the reports come out, they're compared against those normative data, and it's color coded, green, yellow, red. How do you find how did you adapt to interpreting Redival or ERG data, if you will, and results?
Absolutely. This is a great assistance that you don't have to create your own database in your clinic, and there is something ready for use. Therefore, the readings are much simpler. You can go straight into making your diagnosis. If there are any diagnostic doubts, we consult geneticists. But having this ready database is of tremendous assistance.
And what would you say to your colleagues about, who may be reluctant to implement electrophysiology and ERGs in their practice, or have a concern about the ability, the learning curve and the interpretation and so forth? What would you say?
Well, not to be scared. Again, there is this aura of something about ERG that, you have to learn a lot about it, and that you have to spend time, with these outputs that we see with the Retival. It's so much more simpler, and I would just encourage clinics to adopt this technology for all the advantages that it offers, including interpretation of results.
Okay, and one final comment or question. Here we sit in New Orleans, Louisiana. You came from Abu Dhabi, which is a long, long ways away. How does it feel to be back among your colleagues at a meeting like the American Academy of Ophthalmology meeting here in New Orleans?
It feels great, and we needed it. Um, Learning and virtual conferences have their role, but there is nothing like personal touch and discussions outside of the lecture room. So be back to be in physical, and hope we can do more of it.
Okay, well, Dr. Kozak, I thank you very much for your time today and really appreciate you stopping by and sharing your perspective with us. And I'll do an elbow bump to thank you.
Let's do that.
In the
And
time
I
of
thank you,
COVID.
and thank you for this wonderful technology.
You're welcome. Take care and have a wonderful flight back, and enjoy the rest of your meeting.
Thank you very much.
Take care.